Hello, I'm Dr. Erica Onagbola. Thank you for joining me again for oral contraceptives and the menstrual cycle. In this particular chat video, I will be talking about oral contraceptives, active ingredient estrogen, and women aged 35 years and older, and patients that are about to experience menopause and patients who are headed towards not experiencing the menstrual cycle flow. Well, I just wanted to reiterate some of the parts that I mentioned early on, and that the menstrual cycle has different phases, and some of those phases help to regulate hormonal functioning and also the creative aspects of conception. Also, I want to mention that oral contraceptives not only help to regulate the menstrual cycle for conception, but also the regulation through oral contraceptives help to minimize the symptoms that are associated with the menopause phase that are our 35 years of age and older female patients may be experiencing. Okay, so the first ingredient that the main ingredient really in oral contraceptives is going to be estrogen products, and we all know as healthcare professionals that uh, this active ingredient is a hormone, and that it has different side effects, which may include like breast tenderness or breast cancer. Also, it may include headache, migraines, blood clotting, stroke. So it is very important that um, our female patients that are 35 years of age and older decrease those risks when taking oral contraceptives. And um, that could include just watching your weight, watching your nutritional plan, and continuing on a healthy diet. Also, um, making sure that you speak with your healthcare provider to ensure that you're receiving um, low dose estrogen, which could include 30 microgram of estrogen per tablet, and then also that we're monitoring our cholesterol, our glucose levels, and that we are refraining from behavioral habits such as using tobacco products. We highly recommend that our, our, our our population of topic is refraining from using or using tobacco and smoking as well, because it is a known fact that uh, it increases the chances of stroke and of blood clotting as well. So we want to definitely reiterate that. Also, it is important to know that um, patients who are in the perimenopausal phase are also still very fertile, and that the oral contraceptives uh, can still um, help prevent any unplanned conception. Also, before I leave today, I just wanted to speak with you briefly. Also, I want to make mention that estrogen may also not only cause increased cholesterol, but it can also cause diabetes, increasing glucose in the plasma glucose in the bloodstream, and also it could also um, increase risk of migraines and stroke. And in populations of this age range as well. So before continuing on with estrogen products, it is very important to do a bone marrow density test. It is good to do a cholesterol test, a blood glucose test, and also to monitor each individual person's weight, the actual weight against the ideal uh, ideal weight as well, because like I said previously, this can increase chances of blood clotting, heart attack, um, uh, stroke, cardio, cardiovascular disease, that we definitely want to stay away from, and is a known fact with estrogen products. And also, before I leave, I just want to make mention that let your doctor know that if you've had any surgeries or any hysterectomies or ovary removal, that your oral contraceptives do match up with the indication of those events, because some estrogens are not warranted, or some progesterones are not warranted in certain conditions where there has been a removal of female parts, because female parts do release hormones monthly, and so we want to make sure that certain ingredients are on board, and some that need to be uh, not not consumed. Also, before I leave, just to reiterate, there are some over-the-counter medications like boric acid, BORIC. I'll leave it in the comment section. Boric acid, I recently learned, at 600 milligram suppository. There are also tablet forms that can be purchased at a decent price that are over the counter to help prevent infection. That some women may experience after sexual intercourse, and those boric acid products is new on the market, very recent, and can help reduce infection um, when women have intercourse. Bacteria from the vagina, bacteria from the urinary tract are pushed in the direction that leaves them burrowing and replicating and multiplying in those tracks, and then later, within a day or a few days, lead to an infection and side effects that may feel uncomfortable, and may feel the need to uh, visit a doctor for a prescription for antibiotics that are available. But if they can be prevented with over-the-counter medications and non-pharmacological strategies, then we I would suggest that, because not only does this help to reduce the use of antibiotics, which are not obsolete but are becoming less effective in some situations, then I would recommend that our female patients who are experiencing these events, like I was mentioning, use over-the-counter preventive medications, and also non-pharmacological strategies, which could be use of increasing fluid intake, staying hydrated, just cleaning the area of the vagina very clearly and very thoroughly, but not introducing anything, or douching with vinegar or anything like that, but just introducing a warm antibacterial soap or solution into the vagina area, around the area, to help reduce infection, and the use of needing to be evaluated for antibiotic therapy. So it is there are a lot of boric acid products that I have recently learned about and that can be purchased over the counter as well. So, with that being said, I'm glad that you were able to join me and you were able to hear um, some of the very important facts about estrogen products, and also the female menstrual cycle that you can also visit in my other video that I recently uploaded. And if you have any questions or comments, please leave them in the comments section, and I look to hear from you or have you to visit me on the next video. Thank you. Bye-bye.